Good day and welcome to Debunking the Myths with me, Luvuyo Mdeni, the show where we sit down, look at what you've seen on social media in terms of the myths that are flying around related to COVID-19. Now, as South Africa moves from level 4 lockdown to level 3, certain restrictions are starting to be eased. In today's episode, we thought we should rather focus on the concerns that you've had. Alcohol has become a very contentious issue. And today I'm joined by Professor Charles Parry, who is from the South African Medical Research Council. Professor Parry is in charge of is the director of the Alcohol, Tobacco and Other Drugs Research Unit within the South African Medical Research Council. Prof, good day. How are you?
I'm very good, thank you.
Professor, this has been unprecedented times. Firstly, South Africa went into a lockdown of stage 5, slowly easing into other stages. Stage 5 saw a restriction of alcohol, tobacco, and other products. As we go into stage 3, it's going to be a different ball game with the restriction on alcohol being lifted. Over the past, what have you noticed in terms of what has happened from stage 5 to where we are at right now in terms of stage 4, in terms of the use of alcohol specifically in relation to COVID-19?
Thank you for that. I think I'll go back a step further even, because we had what we called lockdown light on the 18th of March, which was when the government, first of all, put some restrictions, and they said that the hours were restricted. So it was from sort of early in the morning, it was 9 to 6 or 9 to 5, Monday to Friday, and then Saturday mornings. And then that was for off-consumption selling. And then for on-consumption, the same hours, but you couldn't have more than 50 people in a restaurant. So we had a chance to see what was going to happen with alcohol at that point, because there was a restriction on the on-consumption sales, a dramatic restriction, and then also some curtailing of the hours for off-consumption selling. And what we found there, I haven't got the stats right in front of me, but certainly from around the country, there were reports, for example, from ambulance services of seeing quite a dramatic drop during that early phase. So we expected that something was going to happen if there was a more stringent lockdown, which happened, in fact, on the 26th of March at midnight, when the next phase, the beginning of phase 5 happened, when alcohol sales were completely banned in any form.
As you know, we call this show Debunking the Myths, and we deal with the questions that you have posed to us, and we'll get the professor to answer those. The first question that we have, Professor, relates to sectors of the economy opening up. Now, let's take a look at that question.
Ngokubona kwami impilo ibaluleke kakhulu ukudlula yonke into, ukudlula imali, imfundo noma beyini. So akuze usisize sisheshe siphindele emsebenzini noma isey'koleni. Kuzokwenzakalani ngoba kulezi ndawo kuyagcwala kakhulu, noma ngabe isibalo sehlile kodwa kuyafana. Uma sike sathelelana kakhulu, uma selibhebhetheke kakhulu igciwane, sizolibamba kanjani ngoba seke bokubhubha komhlaba. Kube bokubhubha kwe-South Africa yonke phela lokho.
Well, I think it means that people will have more money, which is generally a good thing. There'll be a little bit more money in the community. And I guess if people do go back to work, you might get other kinds of injuries which aren't alcohol related, just by purely being commuters and things like that. So we'll see a much greater pressure on our hospitals, and I believe some of the hospitals around the country are already full. So then they'll have to make decisions as to who gets treated or not.
Another question that I'd like to bring forward now to you, Professor, is one that relates to alcohol.
The opening of alcohol sales. I personally feel that you cannot open the alcohol and then you keep the tobacco under lock and key. Those are two things that goes together. There are people that smokes but they don't drink. But then you get people that when they are drinking, they have the urge to smoke. And if a person is using both of them, how can you contain them? How will if they have that urge to smoke and they are drunk, how can you stop that person from smoking?
Okay.
I think there are 4 areas in which, particularly when you look at alcohol, and I'll talk about tobacco in a minute, they relate to COVID-19 risk. The first is that drinking is a social phenomenon, and it can undermine physical distancing regulations, which we're trying to achieve. Basically, people drink together, and that can increase the spread of the virus, community transmission. Secondly, drinking in the home, if it's excessive, it can lead to gender-based violence, even if the victim is drinking or the perpetrator. The third way is, in fact, relates to some modeling we've done at the University of Cape Town and this Medical Research Council, looking at trauma admissions. What happened was in the initial weeks of the lockdown, level 5, we saw across trauma units about a 60 to 65 and even greater % drop in admissions to trauma units. And part of that has been ascribed to just the broad lockdown conditions, and part of it specifically to the ban on liquor sales. Basically, our modeling has found that there are about 42,000 or more trauma admissions per week across about 350 hospitals, public hospitals in South Africa. And the lockdown caused a drop of about 65% of those. And then our modeling has found that of those, about 40% of trauma admissions are alcohol related. So we're getting about 10,000 less alcohol related trauma admissions per week across the country. And then the modeling has shown that just under half, about 5,000 of those, would come back if the ban on alcohol sales was lifted. So that may not sound a lot, but certainly we need those beds, potentially need them, and are increasingly going to need those beds for COVID-19 patients. So that's the third area. The fourth area in which alcohol is related to COVID-19 is alcohol affects the immune system. We've seen it in research on HIV and TB patients, but there's also some research being done overseas looking at alcohol and lung health and immunity. And this particularly relates to heavy drinkers. And we actually have a large proportion of drinkers in South Africa are heavy drinkers. About 59 to 60% of all drinkers actually engage in heavy episodic drinking. We're not a very low-risk drinking population. Many people don't drink, but of those who do, perhaps 60% drink heavily. So what the research has shown that heavy drinkers, it does damage their lungs, and they may not even know it. But when they get a secondary insult, such as from a respiratory infection from COVID-19, then they're going to have worse outcomes. So those are the 4 ways in which alcohol is related to COVID-19.
As we ease into level 3 lockdown, a question that we have here relates to the easing of the lockdown, especially the curfew and the link that we have with alcohol.
Please, because of most of our contraction workers can go back to work to feed the families, but on alcohol is going to be a mess. Our youth are out of control. They don't have any respect now. They're going to be free walking at night to drink beer, not obeying their rules. I wonder what will police do when they see a drunkard roaming the street.
Certainly. I mean, I suppose the government thinks that everybody will buy their alcohol and bring it back and drink it at home. But I think we know that's not going to happen, particularly in crowded communities. People are going to go outside. And particularly if the curfew is lifted, then there's more likelihood that in the late evening that people will socialize. Maybe some people are working, some not. And that can certainly, by breaking the curfew, that will certainly increase the risk, the probability that people will drink with neighbors, and that this will facilitate community transmission. I think it also increases the likelihood that there will be more alcohol-related injuries. We know there's a strong link between alcohol consumption and injuries, and I think we can certainly expect to see more of those things like falls, stabbings, and robberies and things like that, and even motor vehicle accidents, pedestrians being run over and things like that. So I certainly am worried about the fact that both there's a lifting on the ban of alcohol sales, and also now the curfew is being lifted. But certainly the issue of prohibition, which isn't perhaps the right term to use, it's a temporary suspension of liquor sales. It can't continue forever, but I think one can have a discussion about whether this is the most timely moment to be lifting it when the epidemic is moving towards its height in late June, early July. And certainly I think one could make a strong argument that they could have kept the ban on liquor sales. Certainly from a public health point of view, I think one could very, very much defend continuing the ban till the end of level 3 lockdown.
And there you have it. That was another exciting episode of Debunking the Myths with me, Luvuyo Mdeni. I'd like to say thank you very much to Professor Charles Parry from the South African Medical Research Council, who's really helped us understand a lot in terms of what's been happening relating to alcohol and COVID-19. I'd also like to say thank you very much to our participants who've sent us messages using our new WhatsApp number. And if you'd like to be part of this conversation next time, there's the WhatsApp number on screen. Please send us your messages and your questions in terms of what you want answered in relation to COVID-19. And for me, Luvuyo Mdeni, bon voyage.